There's no other joint in our bodies that does as much as our shoulder does. And so it requires a lot of work from those tendons that move our arm. So these wear out, like other tendons in the body, and they sometimes get degenerative over time. There's certainly acute injuries that occur. Someone falls or something of that nature, but most of the time it's a slow process.
The hallmark is this night pain. They cannot sleep. It wakes them up. They have pain with motion, especially above shoulder activities.
Most commonly it's a bursitis or tendonitis that causes the trouble, and usually with medications, possibly steroid injections, and physical therapy, most patients are able to get better.
If it doesn't look completely torn where they can't raise it, we'll typically start with either a cortisone shot in combination with therapy or alone and see how they respond to that.
We talked about anti-inflammatories, rest, physical therapy, even cortisone injections. But again, if you start developing a tear or that tear progresses in size, then that's when we start looking into surgical fixation.
Well, when you do an arthroscopic rotator cuff repair, we usually take the spurs out with it. It's about a 6-week period of immobilization with some passive motion in a sling.
The one downside of the surgery is it's a long recovery process. Even though we do it through a couple poke holes and it looks real nice, it takes people time to recover, usually in the realm of 3 months to a year, and people fall within a continuum. It usually takes about 6 weeks for the tendon to heal, but it takes people 3 to 6 months just to get their strength back and recover from it. So the surgery's not a quick fix.
Surgery, most times we try to hold off as a last resort. I mean, there are times where there's certain things that come up that you certainly need it, and it may be the first thing, but that's more rare than, we usually try to stick to more conservative treatments if possible.
Once that pain's gone, they're able to function better through the day, they're sleeping, they're happier.
So they're happier, they're more refreshed, and then they can use their hand and their arm more often and more vigorously, where they won't get symptoms of, man, I can't do it. And that's important. People don't want to be held up.